The medieval disease that sent kings mad is rife again and killing babies in Queensland. Syphilis was nearly eradicated a decade ago, but it's now at epidemic proportions through the state's north, with hundreds of new cases identified each year. Next week, the federal government will roll out the first phase of a dedicated syphilis eradication program using new test kits to immediately detect and treat the disease. But health workers fear a decade on, it's too little too late.
Fit, young and healthy. Health workers on the sidelines want them to stay that way in a city ravaged by a deadly disease.
It's almost like taboo, and people really don't want to share that they got it.
From almost eradicating it, it's turned into one of the biggest epidemics in recent history.
Dr Darren Russell is testing for syphilis, the sexually transmitted disease that was rife in medieval times and is now out of control in Queensland's northern regions. Cases have exploded from just 2 a decade ago to more than 1,100, even though the infection is easily cured with penicillin. Shockingly, it's also now killing babies. 6 have died in the last 6 years, with the infection passed on by the mother in the womb.
When you hear that, you think, what the hell has happened?
The outbreak started here in Doomadgee on Cape York in 2010 with just a handful of cases. Health workers say it could and should have stopped here. But it's now spread across Queensland, throughout South and Western Australia and into the Northern Territory. And the rest of the country could be next.
What else can be done to stop it at this stage, I'm not quite sure.
Community awareness campaigns are targeted at Indigenous communities with transient residents.
Left untreated, you could lose your baby.
But shame and stigma are stifling efforts to test and treat.
I don't think it's really out there. I don't think people are grasping the real importance of it.
Next week, new test kits that deliver immediate results will be rolled out in Cairns, Townsville and Darwin. They'll eliminate the 2-week waiting period for confirmation and the start of treatment. But it's taken more than 5 years for both the state and federal governments to dedicate specific funding to tackling the issue.
Well, somebody missed the boat because it should not have happened that way.
Health workers fear the extra efforts have come too late and predict more baby deaths. Allyson, ABC News, Doomadgee.